Medicine is a very human practice and profession. The safe and effective scaling of new technologies to improve care delivery. But I think it's an honor to be able to create tools that support those people who are actually delivering the last mile of care. An AI clinician with eyes, ears, and a voice. What's known as an epistemic shift, a change in the way people interact with information.
So welcome to the program, Dr. Clardy, and it's a pleasure to have you.
Thank you so much for having me. It's my first time to Hyderabad. I've fortunately had the opportunity to travel, but the last time I was in India was over a decade ago. And so it's remarkable to see the changes and the innovation, particularly here in Hyderabad and high-tech city.
So I'm sure most people would not like to meet you as a critical care physician. So tell us something about your medical journey and what inspired you to make the shift.
Yeah, I know it's funny. In some ways, used to say, I met patients on the worst days of their lives. And I worked in critical care for a long time. My training was in internal medicine, followed by pulmonary and critical care. And I was very focused on care delivery, ran an ICU, but also very focused on education, and particularly the ways in which how information is presented influences clinical decision-making. Early in my career, I worked at a company called UpToDate that was very focused on transformation of medical information so that it was useful at the point of care. And so I had a little bit of insight on technology and care delivery then. And then I started working with a Google research team on medical records in 2018. I did that job sort of on nights and weekends. I continued to practice clinically through all of 2020 in the ICU. And then at the end of 2020, joined the Google for Health team. And that's really led me to the work that my team and I do now, which is focused on the safe and effective scaling of new technologies to improve care delivery.
So bedside critical care to boardroom meetings, you've made the shift.
Quite a change, but it's interesting that many of the same skills and needs are applicable to the work now. The thing that's a little bit different is that care delivery is very personal and up close. And I think a lot of the work that we're doing now is one step removed, but I think it's an honor to be able to create tools that support those people who are actually delivering the last mile of care.
So let me ask you honestly, was it during the pandemic that you really thought about this shift, or you thought about technology or digitalization or AI? I believe it was during that era.
So it's very interesting. I will say this, that I think anyone who worked clinically through the pandemic was changed by that experience. The whole planet was changed by that experience. I think the experience to me brought forward the fact that the tools that we had to deliver care were insufficient to the challenge that we faced. And I think that even more fundamentally, what I realized in the pandemic was that we were drowning in information that we could not use effectively. So for me, the experiences that I had started to have working as a research associate with Google helped, I think, to give me a little bit of insight on the value of these tools to address the real problems that I experienced in being a doctor. And interestingly, I think it's important that many of the ways that we've thought about applying these tools, especially in the early going, is tools to raise the floor, tools to help organize and present information in a way that helps with understanding, rather than tools that seek to replace or automate care delivery. So the opportunity to sort of think about these tools as assistants, or maybe in the future sort of associates to the people who are delivering care, has been exciting to see.
And also you coming from pulmonary critical care backgrounds, I believe. So I think you would have a different perspective and a different angle at looking at the things during that time.
Very much so, because I think critical care brought some of the vulnerabilities of our entire society and our health delivery system globally into very, very sharp focus. I also think critical care is sort of a unique environment because it's always been extremely data-driven and data-rich. There is so much information that comes from all of the machines and devices and support that patients in the ICU have. And I think now we're starting to see that some of the tools that in the early days were useful for organizing information where latency wasn't so important and you were preparing information retrospectively or without time pressures. I think where I'm really interested to see these tools evolve is the ability to handle increasingly complex kinds of data, ICU data, but also genomic data, wearable data, environmental data, and then to create tools that allow innovation and insight closer to the point of care.
So talking about AI and technology in this world, what are some projects or some innovations that excite you today the most in healthcare?
I'll give you two examples, and I'll think of one maybe as raising the floor and the second as something that's maybe imagining what the ceiling might look like. One of the raising the floor projects that I think we were most excited about, and this is not brand new work, this is now over a year old, was the challenge that providers have, even when good guidelines exist, to know exactly how to treat the patient in front of them. So we partnered deeply with the American Society of Clinical Oncology, ASCO. ASCO has authoritative guidelines on a very wide range of cancers, blood cancers, solid tumors, and they are authoritative, but they're extremely long and complex documents. And so what we did was essentially create a system that would have comprehensive knowledge of all of the ASCO guidelines and that would allow any oncologist to interact with those guidelines using natural language. And so making that available to ASCO members, I think, was a really good example of in some ways, a simple AI intervention, simple by today's standards, but one that unlocked value from data, these guidelines that were recognized to be authoritative, but hard to negotiate right at the plan of care. So I think that that's an elegant demonstration of the ways in which the tools can be used to take existing information and make it more useful at the point of care. But I think what we've seen there is that as we move away from text-based back and forths between an AI clinician, and I'll use that in quotes, and a patient, to really moving towards multimodality, audio and video in real time, and especially looking at some of the things that clinicians are called on to do where there's a disconnect between what you see and what you hear. And so creating systems that can understand the entire environment. We call this an AI clinician with eyes, ears, and a voice. This is to me very exciting because I think it really starts to get into some of the multimodal capabilities that we haven't talked about as explicitly in healthcare and maybe less obvious to folks who haven't had the opportunity to see some of this early research.
So medicine evolves rapidly. So how would you like the young doctors to stay curious and adaptable to this new generation of AI in healthcare?
So it's a wonderful question. I think it is a wonderful time to be a trainee or a new physician, but it's also, I think, a profoundly confusing and in some ways unsettling time. I think we talk a lot about AI, but I sort of think of what's happening right now is a number of new tools have become available that are very, very powerful, and that's kind of causing what's known as an epistemic shift, a change in the way people interact with information and the tools that create that information. And so I think what we're seeing is all of us are going through an epistemic shift, but it is more obvious for those who are in training and those who are students. My message to those folks is that it's not only an exciting time to be in medicine, but it's also an exciting time to develop a certain kind of curiosity that medicine hasn't always embraced. And so I think that in some ways the most exciting thing that's happening right now is that learners are using tools in new ways. And I think that in a very exciting way, our learners will lead our teachers in understanding some of how this new technology really will influence both education and care delivery.
So, Dr. Clardy, I'm sure you've helped many people touching their lives in the most difficult times. So, what is that one message you would like to share with the audience out there as far as healthcare or AI or anything about critical care is concerned?
One thing that has, I think, become clearer to me, even in a very confusing time, is that medicine is very human practice and profession. And even with all of these new tools, you can't deliver care without a human interacting with another human. And so I think that the most important things that AI does is not to take away that human to human connection, but to augment and to elevate the ability of a provider to really meet a patient where they are.
Absolutely. I think you've brilliantly put it up. So thank you, Dr. Clardy. It was wonderful having a conversation with you. Thank you so much for it.
Thank you, Lakshmi, for your time. I appreciate it.